Hello, I'm Vanessa. It's a pleasure to be here with you today. I would like you to thank you for the invitation, and also I would like to declare that I have no potential conflict of interest to report. In 2020-2021, healthcare systems were under stress due to the pandemic caused by coronavirus. International estimates reveal that the need for intensive care units is greater, and with the involvement of elderly and also obese patients in critical conditions. Patients with COVID-19 with severe acute respiratory syndrome are at a particular risk, a higher risk for development of pressure ulcers. In view of this, prevention and treatment of pressure ulcer has become challenging because these patients are critical patients. They are obese, they are big patients, they are in critical care, and it's difficult to change their position and it's difficult to implement the pressure ulcer preventive protocol. Pressure ulcer is defined as a localized damage to the skin and underlying tissue as a result of pressure or pressure in combination with shear. Pressure ulcer usually occur over a bone prominence, but may be also related to a medical device. Pressure ulcer is a complex and multifactorial wound triggered by both intrinsic and extrinsic factors. Extrinsic factors such as the fact of the patient is in the same position for a long period of time, and intrinsic factors such as malnutrition, vasomotor failure, peripheral vasoconstriction due to the use of vasoactive drugs, changing body mass index, also the presence of chronic disease, and finally, due to urinary and fecal incontinence. Pressure ulcer occur due to the forces of a patient's body weight or as a result of external force, such as those applied by a medical device or other kind of object, or even for a combination of these factors. The injury can present as intact or an unbroken skin, or more frequently as an open wound. The tissue damage occurs as a result of intense and prolonged exposure to sustained deformation in pressure, friction, and shear, or in a combination of these loading modes. The tolerance of soft tissues for sustained deformation differs by tissue type and may also be affected by microclimate, perfusion, age, especially older age, health status, either chronic or acute disease, acute conditions, health conditions, the presence of comorbidities, or also the conditions in the local soft tissue. And the relevant risk factors for pressure ulcer can be divided in two big groups. First, the mechanical boundary conditions that are related to extrinsic factor include magnitude and time duration of the applied mechanical loads and their mode of action, such as compressive, friction, or even shear. And then the tolerance of the individual that is related to intrinsic factors, as internal anatomy include prominence, bone structure, or tissue morphology, or mechanical properties of tissues, or even tissues repair capacity. And talking about COVID-19 patients, the prevention and treatment of pressure ulcer in these patients should follow the steps that are determined by the guidelines because they are critical patients. Are those steps: risk factors and risk assessment, skin and tissue assessment, a preventing skin care routine, and we have interventions that are for both, even for prevention and also to treatment of pressure ulcer, as nutrition care, repositioning and early mobilization, heel pressure ulcer care, the use of support surfaces, and also device-related pressure ulcer care. So, speaking about risk factors and risk assessment, risk assessment is a central component and should be the first step to identify individuals who are at risk to pressure ulcer, and both modifiable and non-modifiable risk factors should be included in this assessment. However, pressure ulcer prevention should be focused on modifiable risk factors. And individuals who are at high risk of pressure ulcers, are those characterized by multiple risk factors, such as those included in this table. For example, activity and mobility limitations, the skin status, perfusion, circulation, and oxygenation factors, nutrition indicators, moisturies, a lot of moisture in the skin, body temperature, older age, sensory perception limitations, some block markers as albumin, and both general and mental health status. In Brazil, we use Braden scale for adults, and for children, we use Braden-Keel scale for assessment of the risk to pressure ulcer, because both scale include even a stress factor and also intrinsic factor related to development of pressure ulcer. And speaking about skin and tissue assessment, skin and soft tissue assessment is a key component and should be used for pressure ulcer prevention, classification, diagnosis, and also the treatment of pressure ulcer. So the condition of skin and underlying tissue can serve as an indicator of early signs of pressure damage. A routine skin and tissue assessment provides an opportunity for early identification and treatment of skin alteration, especially pressure ulcer. And a skin and tissue assessment should be performed at least once a day in the admission of the patient, and at least daily, once a day. And it's really important to document the skin tissue conditions, especially thinking about legal condition, legal issues. So a preventive skin care routine is very important because maintaining a healthy skin requires a care planning that involves skin hygiene, skin moisturizing, continence management care, especially for this patient that have diarrhea. COVID-19 are higher risk of diarrhea, bad linen, and the use of prophylactic dressing. So it's important to implement a skincare regimen that include the use of a high absorbance incontinence product to protect the skin in patients who are at risk of pressure ulcer and have urinary incontinence. And it's important to talk about diarrhea because COVID-19, they have diarrhea, frequently they have diarrhea. So it's a lot of moisture in their skin and their risk of pressure ulcer are higher. And it's important to consider using testling bed linen with a low level friction coefficient when mobilizing the patients in order to avoid to decrease the friction between the patients and the bed. And also, and finally, to use a soft silicone multi-layered wound dressing to protect the skin. And we have a lot of interventions that are for both situations, even for prevention and also for treatment of pressure ulcer, as a nutrition plan, repositioning and early mobilization, heel pressure ulcer care, the use of support surfaces, and also device-related pressure ulcer care. The recommendation on nutrition in pressure ulcer prevention in treatment is extensive, but basically it's important, it's mandatory to conduct a nutritional screening, a nutritional assessment for individuals that are at risk for pressure ulcer, and to develop and implement an individualized nutrition care plan providing at least from 13 to 35 kilocalories per kilograms of body weight and 1.2 to 1.5 grams of protein for kilograms of body weight for adults daily, and to provide an adequate water or fluid intake for hydration considering the age and the health status, the health condition of the patient. So now one of the most important care for these patients is about repositioning and early mobilization. So it's important to reposition all individuals, all patients who are with or at risk of pressure ulcer on an individualized schedule unless it is contraindicated. And it's important to determine the repositioning frequency with consideration to the individual's level of activity, mobility, and also the ability to independently repositioning themselves. And it's important to reposition the individual using manual handling techniques and also equipments to reduce the friction and the shear between the patients and the bed. And when repositioning the patients, it's important to use a 30 lateral degree side lying position in preference to a 90-degree sideline position in order to avoid the excess of shear of pressure in this trochanter area. It's very important. And also to keep the head of the bed as flat as possible, less than 30%, and to avoid extended use of prone position unless is required for management of individual medical conditions. So these both situations are really difficult in COVID-19 as they are critical patients and they have respiratory disorders. So they need to keep the head usually above 30 degrees, and usually it's used a long period of time in prone position for these patients. And when promoting the sitting out of the bed, it's important to use an appropriate chair or wheelchair and to be in this position for a limited period of time. And if it's possible, to select a reclined seated position with the individual's legs elevated, or ensure that the individual's feet are well supported on the floor or on a footrest and sitting as we can see in this figure here. And it's really important to tie the seat to prevent the individual sliding, and teach and encourage individuals who spend a long period of time in seated position to perform some pressure relieving rendering maneuver. Thinking about real pressure ulcers, it's really important to assess the vascular and perfusion status of lower limb, heels, and feet when performing a skin and tissue assessment as a part of a risk assessment, as a part of a skin and tissue assessment, and to elevate the heels using a specifically designed heel suspension device or even a pillow or a foam cushion. And it's important when we are using a pillow, we pay attention in using it without placing pressure on the Achilles tendon and at the popliteal vein in order to prevent thrombosis. And also use a prophylactic dressing as an adjuvant to heel offloads and other strategy to prevent heel pressure ulcers. And about support surfaces, when select a support surfaces, it's important to select one that meets the individual's need based on the following factors: the level of mobility and inactivity, the need to influence microclimate control and shear reduction, the size and weight of the patient, the number, the severity, and the location of pre-existent pressure ulcer, and also the risk for development of a new pressure ulcer. And about device-related pressure ulcer, when selecting medical devices, it's important to consider the device's ability to minimize tissue damage and also the correct size and shape of the device for your patient. And to assess the skin under and around the medical devices as a part of a routine skin assessment. And at least in this area related to medical device, it's important to perform this assessment twice a day because the risk in this area is higher. So talking about prone position that is widely used in COVID-19 patients, studies have shown that early prone position for a prolonged period of times, more than 16 hours, in COVID-19 patients has been shown to reduce the mortality in these patients. So, since the beginning of the pandemic, the prone position are widely used in all the world. Although prone position has a pulmonary protective effect, complications can occur such as accidental extubation, hypotension, facial edema, removal of medical devices, bronchoaspiration, and finally pressure ulcer related to prone positions and especially related to medical devices. When in prone position, it's important to use a support surfaces to reduce the pressure in prone position. So, however, there is no formal indication of the best support surfaces and nor evidence of the superiority of one type of support surface in relation to another. And in Brazil, we ask for the manufacture of a special low-cost pillow, this pillow for prone position, because we had a lot of patients in prone position and we had a low budget. So we asked for this special low-cost pillow. And when in prone position, it's really important to take a special care with the face, chest, iliac crest, pubic symphysis, the penis, scrotum, knees, and fingers, taking into account the redistribution of pressure in this area and using cushions to relieve the pressure in this area. And it's really important to aspirate nasal and oral secretions frequently in order to avoid excessive moisturizing on the face. And these are special pillows that we manufacture for using in the face, and it's important to consider using a polyurethane foam in the face area. As foam it's expensive in Brazil, we use on the body surface hydrofilm, and on the face hydrocolloides dressings because it's cheaper. And it's important to check the placement of all medical devices in order to avoid associated related injury. And in prone position, it's important to switch the head position manually every 2 or 4 hours according to the individualized assessment. And when alternating the arm position in swimming arm position, it's an opportunity to assess the integrity of the skin in arm, head, or in even face. And it's also important to assess all pressure points when prior to proning in the anterior surfaces of the body and when returning to supine position in the posterior surfaces of the body. And after the procedure, it's important to document all skin assessment and preventive measures implemented, thinking about legal issues. So let's talk about the treatment of pressure ulcer. So the treatment of pressure ulcer is complex and involves the following steps. First, the etiological diagnosis, especially thinking about moisture lesions, as for example, incontinence associated dermatitis, that is the most common wound in confusing with pressure ulcer. And then, when you are sure that's a pressure ulcer, it's important to classify the pressure ulcer according to the tissue damage. And it's also very important to maintain interventions for prevention of pressure ulcer, because in the treatment of any kind of wound, it's really important to remove the cause. The cause in this case, the cause is pressure and shear. So it's important to remove the cause in order to improve the healing process. And even though this patient has pressure ulcer, unfortunately he can develop another one. So we need to maintain all the interventions for prevention of pressure ulcer in the treatment of pressure ulcer as well. And finally, the wound bed preparations, the local management of the wound. And we should follow the timer's recommendations for the wound time preparation. So talking about etiology diagnosis, moisture lesions are often mistaken for superficial pressure ulcer as stage 1 and even stage 2 pressure ulcer. And how competent are nurses in distinguish between the two, between dermatitis and between pressure ulcers? So, incontinence-associated dermatitis represents a significant health challenge around the world, and it's a well-recognized risk factor for pressure ulcer development because it compromises skin tolerance. And IAD is described the skin damage associated with exposure to urine or even to stool or for both, and it causes discomfort and can be difficult time consuming and also expensive to treat. IAD typically is presented as inflammation of skin surface characterized by redness, and in some cases we can have swelling and also the blistering formation. Even though incontinence-associated dermatitis and pressure ulcer have different etiologies, they may also coexist in the same patients. So, on one hand, we have incontinence-associated dermatitis as a top-down injury. So, the damage is initiated on the surface of the skin due to the contact with urine or stool or both, for example. On the other hand, we have pressure ulcer that are believed to be a bottom-up injury, where damage is initiated by changing with soft tissue below and also with the skin. So they have this difference. So here in this table, we can see the main difference between pressure ulcer and incontinence-associated dermatitis, IND. So pressure ulcers are usually located over a prominence or under a medical device or other kind of object, while IND are usually located in the perineal or perianal area, inner thighs, or even buttons. Pressure ulcers are always usually associated with a reduce in the mobility or even a reduce in the sensorial awareness, while incontinence associated dermatitis are usually associated with urinary or fecal or both kind of incontinence. Pressure ulcer usually initiated as a superficial wound, but it can evolve to a deeper wound with the presence of necrosis, for example, while IND it's always a superficial kind of wound. Pressure ulcer has a rounded shape or even an oval shape with distinct borders, while IAD has an irregular and indistinct borders involvement. Pressure ulcer may have necrotic tissue and may also have undermining and tunneling, while IAD has a sun-round skin, typically macerated. As diarrhea is common in COVID-19 patients, especially the critical ones, in Brazil during the pandemic, we use this device that's a temporary device for control of diarrhea. So it's a temporary device indicated for immobilized and also incontinence patients with liquid or semi-liquid stool. So we used this device in our patients with diarrhea in order to keep their skin clearance and also to keep them comfortable and also to reduce the risk of pressure ulcer once the diarrhea compromise the skin tolerance and increase the risk of pressure ulcer. So once you are sure that you have a pressure ulcer, it's important to classify the pressure ulcer. So it's important to use a pressure ulcer classification system to classify and also to document the level of tissue loss. So in stage 1, we have an unbroken skin. We have an intact skin with no blankeable erythema. And this kind of wound is localized over a bone prominence or even over under a medical device. In stage 2 pressure ulcer, we have a partial thickness skin loss or even a blister. So it's a partial loss of dermis presenting as a shallow open ulcer. In the stage 3 pressure ulcer, we have a full thickness skin loss. Subcutaneous fat may be visible, but bone, tendon, or muscle are not exposed at this level. On stage 4 pressure ulcer, we have a full thickness tissue loss with exposed bone, tendon, or even muscles. Necrosis may be present on some part of the wound bedding on this stage. And when we have an unbroken skin, but it's purple or maroon localized area or discolorized area of skin, we have a deep tissue injury. And finally, unstageable pressure ulcer, when we have the full thickness tissue loss and the base of the wound is covered by slough or by scar with a brown or black color in the wound bed. And finally, the wound bed preparation or the local management of the wound in the treatment of pressure ulcer. So, for the wound bed preparation, we should use timers wound care. That are strategies for wound bed preparation. In these strategies, which letter stands for a specific aspect of the wound assessment and also the wound treatment regarding wound bed preparation. So here we have the letter T about assessment of the tissue in wound bed, thinking about the presence of necrosis and the importance of the wound debridement for the treatment of pressure ulcer. And then the letter I, thinking about the presence of inflammation and infection and the importance of decrease the amount of bacteria in the wound area to improve the healing. And then the letter M, thinking about moistury and the importance of control to have a moistury balance in the wound to promote healing wound. And then the letter E, thinking about the head, thinking about the surround area of the wound. And in 2018, a consensus panel recommended updating the term time to timers, including also the letter R, thinking about regenerations, and the letter S, thinking about social factors that can affect the healing process. So to optimize the healing process, the guidelines recommend the use of different technologies for the treatment of pressure ulcer, such as photobiomodulation with the use of low-level laser therapy, or even the use of lead, red lead or blue lead, the use of negative pressure therapy, and also the use of hyperbaric oxygen therapy. As COVID-19 patients can be obese, the size of the wound, the pressure ulcer, usually is huge. So the use of this technology as an adjuvant is very useful for us. And in conclusion, pressure ulcers are often, but not always, preventable. It's a quality indicator, a negative quality indicator of the healthcare systems. And it's still an underestimated problem. Increase the length of stay in hospital and also increasing the cost, and may also be related to increased morbidity and mortality. And thinking about COVID-19 patients, as they are critical patients, the implementation of a pressure ulcer protocol and training of health professionals is mandatory in this scenario. So thank you for the invitation and thank you for your attention.